What is the difference between QA and QC? You may hear people incorrectly call QC at the hospital QA. I even have an X-ray unit that I work with that the button even says QA and not QC. QA is everything from A to Z during a patient's stay at the hospital. It includes scheduling, how long they waited, time for treatment, time for exams, billing, etc. QC, on the other hand, tells us how well our equipment is functioning. I'm sure most of you have seen a weekly QC test being done at your hospital. We test things like exposure reproducibility, is correct May stations, collimation, KVP selection, etc. QC can be done weekly, monthly, bi-monthly, semi-annually, or annually. Usually the physicist does most of these tests. But maybe you have some of these responsibilities. Save this chart. We are going to go over each of these, but this chart might help you to remember what numbers are under what section. Practice writing this chart 1,000,000 times. So it's second nature, and as soon as you sit down for the registry, write it out. Plus 1% is our centering light and angulation. Is our CR in the middle of the IR bucky? If we select a 35-degree angle, did it actually stick at 35 or did it drop a little? Plus 2% is our collimation and detent distance. The penny tool test can be used to check this. Put a row of pennies on the inside of the border of the light and a row of pennies on the outside border of the light. Do you only see the row of pennies that were in the light, or is there some cutoff? Is your 40 inches actually 40 inches, or is it 39? KVP should be shooting at 5% of what you have selected. We use a dosimeter to test the KVP selection. In this case, I had 75, selected on the control panel, but it actually shot at 75.5, not a big deal. The timer part of MAs should also be at 5%. If it is actually shooting at the technique we have selected, is it really shooting at 10 milliseconds? Or is it actually shooting at 20 milliseconds? Which would totally change the actual MAs selected. To figure this problem out, take the number given and multiply it by 0.05 to get the acceptable variance. In this case, it's 7.5 milliseconds, meaning answer A is the only appropriate answer. Same thing for the KVP question. Multiply by 0.05. Plus 5% is the exposure reproducibility. Have you ever taken a second X-ray and got a totally different exposure indicator? It might not be within the 5% of exposure reproducibility. Also, have you ever had two monitors right next to each other and one of them is way brighter than the other? Uber annoying. 10% is the MA station and our AEC chambers. Again, is it shooting at 200 MA or 210? That ultimately changes the MAs. Our AEC chambers should also be terminating at 10% of the predetermined exposure. To do this problem, multiply the MA station by 0.1. The monitor needs to be within 15% of the brightness set.